request him.
Yeah,
to
I
have
will
his
actually
talk.
cut
Yeah,
short
sure.
my talk. That's why I'm reducing the thing. So my talk is on proliferative diabetic retinopathy. I'm changing the slide. The reason is all of us know this before. So the diabetic blindness, we know the diabetic macular indications, and I'm directly going to the video. I think you have already discussed, because the next session I can see people entering. So I'm just going to my case 1, yeah, and then I'll show oh. So this is a diabetic where we're using a 23 gauge vitrectomy, 3-port, and I'm happy that we started using from 2004 with the Mark Humayun. The idea is that a patient with a vitreous hemorrhage, and when you see ultrasound, you have a proliferations arising from the optic disc and macular region. So first you release the tangential traction, as you see here, and then make sure that the whichever is like very close to the disc, you can see that now you can see the traction which is there on the nasal retina, and the idea is to release the anteroposterior traction, the tangential traction, and then later use the same port. You are seeing right now diathermizing, and then you can also use the proportional mode. So you are now making a cleavage between the proliferation over the optic disc and the periphery, and then you trim the proliferation. The idea is so that you release all the traction, and then the chances of rebleed also can be reduced to the minimum. And here you are making sure the stock is there, reduced to as much as small as possible. Some people even pluck it, but I think there's a risk of hemorrhage. So and then you have to make sure when you're diathermizing, don't diathermize the optic disc region. And you see here the whole thing is cleared, and the pre-retinal hemorrhage is cleared using the retinal brush and a pan-retinal photocoagulation done. And if you have no iatrogenic complications, and then all the traction released, you can use a fluid air exchange, and then use the gas as a temporary tamponade, and then the surgery is done. And then many times the next day you don't see as nothing has been done, because it's a small incision, micro incision, which is surgery. And the vision improved to 618. And here other case where you see a proliferation like this, and you can see post surgery the proliferation is removed, and you can see optic disc slightly paler. So that's why we give the intraocular pressure less and then do it. And they already Dr. Srinivas Joshi showed we can do combined cataract with the implant and with the vitrectomy and all the armamentarium. And here we use the third case where you use a proportional mode to dissect the membranes, which idea is instead of using the forceps and scissors, you have a proliferation like this. You can you do the vitrectomy, and then using the same port is you can use the 77 gauge or the 25 gauge. You can see the proliferations are being trimmed, and you can use the cutter and even remove the pre-retinal hemorrhage. And you need expertise, but I think you can use the proportional mode to split between the membrane and the retina, thereby pushing fluid. It is like so that you instead of catching with the forceps, and then you can do this is the proportional mode. You need patience, and I think using the fluid as a proportional mode with the machine, you'll be able to separate the membrane. It takes time, but I think it's worthwhile, and you can release all the traction and then complete pan-retinal photocoagulation. And if you are meticulous, originally the iatrogenic breaks were 20%, and now maybe 4 to 5%. But I think if you are meticulous for a given patient, you can even 100%. You need not have a iatrogenic break. And it's the idea is whatever the case you do. And then we also have a program when a diabetic patient who's blind and gets vision, we actually cut a cake, which is I tell the patient you should not eat. And the idea is they give interview, which is I call it as a happy smile, because they come blind and they can go at least one. This patient had a 636 vision in one eye, another eye only counting close to face. So as in all India, we have doing the screening through teleophthalmology to prevent diabetic blindness, and we hope everybody will have Vision 2020, and that's our aim as in all India. Thank you very much.
Yeah, thank you. Thank you very much, sir. Thanks a lot. Yeah.